What is neuromyelitis optica, NMO versus MS? Have you ever wondered how neuromyelitis optica, often called NMO, differs from multiple sclerosis, known as MS? Both are autoimmune diseases that impact the central nervous system, but they have distinct characteristics. Let's explore these differences in detail. Neuromyelitis optica primarily targets the optic nerves and spinal cord. In NMO, the immune system mistakenly attacks astrocytes, which are star-shaped cells in the brain and spinal cord. This attack is driven by antibodies against aquaporin-4, a specific protein found in about 80% of NMO patients. In contrast, multiple sclerosis affects the brain, spinal cord, and optic nerves. MS involves immune-mediated damage to oligodendrocytes, the cells responsible for producing myelin, which insulates nerve fibers. The lesions in MS are typically more spread out within the central nervous system. When it comes to clinical presentation, both conditions can lead to optic neuritis, which is inflammation of the optic nerve. However, optic neuritis in NMO is usually more severe and often affects both eyes, while in MS, it may occur less frequently and with less severity. NMO attacks can cause significant spinal cord symptoms, such as weakness or paralysis in the limbs, sensory loss, and issues with bladder or bowel control. MS generally follows a relapsing-remitting pattern, where symptoms come and go over time, while NMO tends to have more frequent relapses but rarely progresses to a secondary progressive stage. Imaging studies also reveal important differences. In spinal cord magnetic resonance imaging, NMO lesions are often longitudinally extensive, spanning 3 or more vertebral segments. These lesions are usually located centrally within the spinal cord. On the other hand, MS lesions are typically smaller, patchy, and found more towards the edges of the spinal cord. Brain imaging in MS often shows multiple lesions in specific areas, while brain involvement in NMO is less common and presents differently. A key diagnostic feature of NMO is the presence of aquaporin for antibodies in the blood, which are not found in MS patients. This antibody test is crucial for distinguishing between the two conditions. Additionally, optical coherence tomography, a technique used to image the retina, shows more significant thinning of the retinal nerve fiber layer in NMO compared to MS. Treatment for these conditions also varies significantly. Since NMO and MS have different underlying mechanisms, some treatments for MS, like interferons, can actually worsen NMO. Therefore, accurate diagnosis is essential to ensure that patients receive the correct immunosuppressive therapies tailored to their specific condition. In summary, while neuromyelitis optica and multiple sclerosis share some symptoms and affect similar areas of the central nervous system, they are fundamentally different diseases. Understanding these differences is crucial for proper diagnosis and effective management. If you or someone you know is experiencing symptoms, it is important to consult a healthcare professional for personalized advice and treatment options.